Before you start watching this video, you need to understand that bariatric surgery isn't necessarily the best solution for everyone. It's only one option. The following criteria are required for bariatric surgery. You have a BMI of 40 or higher, or you have a BMI of 35 to 39.9 with other medical complications such as diabetes, high blood pressure, or high cholesterol. If you don't know what your BMI is, talk to your doctor or use the BMI calculator on our website at beaumont.org/weight. You are between the ages of 18 and 75. Psychologically, you're in a relatively healthy place. Besides losing weight, you're also committed to making lifestyle changes. If you meet all of these criteria, you should continue watching this video. If you're not an ideal candidate for bariatric surgery, you may want to consider our non-surgical weight loss program. For more information, visit beaumont.org/weight.
This video is the first step on the path for people considering the bariatric surgery program at Beaumont. Before making an initial appointment, we ask that you please watch the video or attend one of our in-person seminars. After the video, please complete the online form to begin the registration process.
Chances are, if you're watching this video, you or someone you love needs some help losing weight. Perhaps you've been working on a diet that hasn't quite helped you achieve your goals, and now you're thinking about weight loss surgery. Just by watching this video today, you're taking a big step towards becoming healthier. You recognize there's a path you must follow. The good news is you won't be alone. At Beaumont, we will be with you every step of the way, incorporating a multidisciplinary team approach where you are the most important member. Beaumont's weight control centers have several offices across our area. Our team of medical experts includes physicians, exercise physiologists, psychologists, and dietitians. Each of them will work with you before the operation, making sure you're medically, physically, and psychologically ready for surgery. We also partner with you during recovery to help you achieve optimal results.
After we determine that you do qualify for surgery, we want to make sure you have a good understanding of the journey we'll be taking. This information will be the steps we'll take together to ensure that you have the best outcome. The first step is insurance. Did you know some insurance plans exclude coverage for the surgical treatment of obesity? They may also exclude a second bariatric surgery. Beaumont will help verify whether your insurance company covers medically necessary bariatric surgery. If you're covered, you should know some insurances want you to document medically supervised weight loss, and most require that you've tried medical weight loss first. Some insurances also require the surgery to be done at a hospital that has a center of excellence or some other specific accreditation. Many of the Beaumont hospitals fulfill this requirement.
The second step is getting to know your care team. Beaumont is unique in that we have an interconnected team of medical professionals. They will do a primary assessment of your health. This requires 4 appointments at one of our weight control centers. The first appointment is with a physician or nurse practitioner at the weight control center. At that time, we'll review your medical history, draw blood for lab work, and check your heart with an EKG test. We'll determine if further advanced testing is necessary to get you to surgery safely and consult your own medical specialists as needed. At this time, office visit copays and deductibles would apply.
After the initial medical exam, you'll schedule appointments with the rest of Beaumont's network of experts, which include one of our psychologists, dietitians, and exercise specialists. We believe this team approach is critical to your success. To help keep you on track, we offer a bariatric support package. It provides a preoperative instruction class, individual visits with a dietitian, individual exercise programming, bariatric support groups, and a body composition scan.
The third step is follow-up. After you complete the 4 appointments with your team of experts at the Weight Control Center, you'll have follow-up visits with the medical provider and the psychologist. These visits are billed to your insurance. You'll also have visits with a dietitian and exercise physiologist, which are covered through your bariatric support package fee. We are here to support you and your goals. Please take part in weekly bariatric support groups, our lifestyle foundation classes, and cooking demonstrations. These reinforce lifestyle and behavior changes.
The fourth and final step is operation preparation. Prior to your operation, you'll have a consultation with the surgeon. A dietitian will also work with you on a meal replacement diet, actually starting this diet before surgery. Finally, you'll have a preoperative group instruction class at one of our Beaumont Weight Control Centers. This is where you'll learn what to expect after surgery, what to eat, how to take vitamins, and more. We know that deciding to have bariatric surgery hasn't been easy. Rest assured, with Beaumont, you'll be with a team of medical experts. Our bariatric program was started in 2001. We're a high-volume facility performing close to 800 weight loss surgeries per year. At Beaumont, the surgery takes about 2 hours and is performed using the latest minimally invasive laparoscopic technique. That means we use small cuts to insert surgical tools versus a large cut in the middle of your belly. This technique shortens hospital stay and recovery time. In fact, a typical hospital stay is about 1 to 2 days. A person can return to full activity in 1 to 3 weeks, with restricted lifting for 3 to 4 weeks. Beaumont specializes in 3 different kinds of laparoscopic bariatric surgeries. Let's take a look at each option.
Let's focus on gastric bypass first. This surgery has a long track record and was developed in the 1960s. The surgeon divides the stomach into a large and small pouch. This new, small stomach makes people feel full quicker, causing them to eat less because the stomach can only hold so much food. The small pouch is disconnected from the rest of the stomach. The first part of the small intestine is also disconnected, then reconnected further down the small intestine. By doing so, this lessens the absorption of calories and nutrients by your body. This way of losing weight is called malabsorption. To avoid vitamin and mineral deficiency, we recommend taking multivitamins and calcium supplements. Like any operation, results will vary. The good news is, people typically lose over 100 pounds, that is, approximately 60 to 80% of their excess body weight. The weight loss usually levels off at 1 year. After surgery, there's a greater suppression of the appetite hormone due to the surgical changes. Gastric bypass surgery also enhances the levels of glucagon-like peptides, or GLP-1, which improves type 2 diabetes control and produces high rates of diabetes remission. Gastric bypass is also a very good surgical option for those suffering from poorly controlled heartburn. One of the more common side effects is called dumping syndrome. This happens because food, especially sugar, moves from your stomach into your small bowel quickly. This can cause nausea, a racing heart, cramping, or diarrhea. To prevent it, avoid things that are high in concentrated sugars. Another thing you will need to avoid are anti-inflammatory medications such as aspirin or pain relievers. The major complication rate is around 3%. Early complications could be leakage of new connections, the dumping syndrome, nausea or vomiting, and blood clotting. Later complications could include stomach ulcers, small bowel obstruction, kidney stones, gallstones, gout flare, vitamin and mineral deficiencies, hair shedding, and stoma narrowing. The second kind of bariatric surgery we perform is called sleeve gastrectomy or gastric sleeve. Unlike bypass, this only changes the stomach by removing a portion of the stomach. More specifically, we transition the stomach from something that is wide and stretchable into a long, narrow sleeve or tubular shape. No foreign objects are put into the body and no adjustments after the surgery have to be made. Unlike bypass, there's no malabsorption and it's irreversible. As with gastric bypass, there is a suppression of appetite due to the surgical changes. While results will vary, gastric sleeve patients usually lose about 100 pounds, about 60% of their excess body weight. Weight loss also typically levels off at 1 year. The remission of diabetes is a little lower than what we see with gastric bypass. The overall major complication rate is less than 2%. Early complications can include leakage of new connections, nausea or vomiting, and blood clots. Later complications could be gallstones, gout flare, vitamin and mineral deficiencies, hair shedding, and heartburn or acid reflux. The final type of bariatric operation performed at Beaumont is called lap band. Like the name suggests, what we do is wrap a ring-shaped band around the top part of the stomach. This restricts food intake, helping you lose weight. It's a simple procedure and reversible. With a lap band, nutrients are also normally absorbed. Weight loss, however, is slower and harder to predict. People with a band could lose 1 to 2 pounds per week, and it may take 3 years to reach your maximum weight loss level. In the end, this could mean 40 to 50% of excess weight loss. Results are marginal if someone's BMI is over 50. Diabetes remissions is less common than with other procedures. In the first year, the band will require adjustments every 6 weeks or few months. Solid foods can be difficult to swallow, and it could create problems with heartburn. About 20% of patients ultimately need operative repairs, and up to 30% could end up having the device removed or converted to another weight loss surgery due to lack of weight loss or other complications. Early complications could be nausea and vomiting or blood clots. Later complications could be gallstones, gout flare, vitamin and mineral deficiencies, and hair shedding.
Now you know the surgical procedures that are available to you. At Beaumont, you'll have the option to choose your weight control center and hospital location, as well as your surgeon. Our experts will partner with you to guide you towards the best operation choice for you. Here are some other things that you should know about laparoscopic bariatric surgery. In addition to weight loss, the mental and physical benefits of bariatric surgery could really positively impact your life. 95% of those who had it say the quality of their lives significantly improved. And there was a 30 to 40% reduction of premature death risk among patients who were treated with weight loss surgery. That's because bariatric surgery helps to improve or resolve more than 40 different obesity-related diseases and conditions, including type 2 diabetes, heart disease, certain cancers, sleep apnea, GERD, high blood pressure, high cholesterol, joint pains, and related problems.
Surgery is a powerful tool, yet it's no magic cure-all and is only part of the journey. Obesity is a chronic medical disease and weight regain can occur. Bariatric surgery, in partnership with lifestyle changes and Beaumont's weight control centers, can help you achieve your goals, support your journey, and take you where you want to be.
Your road to bariatric surgery starts at any one of our area weight control centers. Make an appointment now at beaumont.org/bariatric or call 888-899-4600.